Welcome back. Our next guests, they want you to smile with confidence. And joining us now in today's Dental Watch, we are joined by Dr. Richard Aguila from the Jacksonville Dental Specialist. You're a periodontist. It's good to see you as always. So one of the things you say that you help your patients with are really complex dental cases.
Yes. Dr. Naraki and I are both specialists. I'm a periodontist. My specialty is more on the surgical side. And Dr. Naraki is a prosthodontist, so his specialty is on the restorative side. So we work together. We see a lot of complex cases. And we're going to talk about bone grafting today. And typically, when we talk about bone grafting, it's preparation for dental implant placement. So
yeah, I was going to say, what is that? What, I mean, people who don't know what that term means, what is it?
Yes. So bone grafting is adding or augmenting bone where it's deficient. So we typically use sterilized cadaver bone or autogenous bone, bone from another area of the body, and add bone where it's deficient. And it's very important that we have a stable foundation for the dental implant. It could be a single dental implant replacing a single tooth, or multiple dental implants replacing a whole arch of teeth. So we do bone grafting to stabilize the foundation, to provide good long-term stability for the prosthesis.
How does that happen that you don't have bone? How do you lose bone?
That's a great question. You can lose bone due to infection or abscess. Anytime you lose a tooth due to trauma, you lose bone that way as well. And if you've lost a tooth a while ago, typically what happens is you get bone loss or atrophy over time. The nice thing about having teeth or having dental implants, it helps stimulate and maintain the bone. So if you've lost a tooth either due to infection, due to trauma, or you've lost a tooth at a younger age, you most likely have a deficiency in the bone and may need the bone grafting in order to get dental implants.
So it's like a snowball effect, right? If
Correct.
you lose a tooth, then all of a sudden you just kind of go down this road.
Correct.
Okay. How do you decide which bone grafts to use for dental implants?
Okay. So there are 4 basic types of bone grafts. The most common one is autogenous grafts. Basically, we use the patient's own bone. The disadvantage is you have to go to a secondary site. We typically go to the 3rd molar area, maybe the chin. If you're an oral surgeon, sometimes they go to the hip. It is a very predictable way to graft. It is the patient's own bone. Any minor bone grafting is typically done with sterilized cadaver bone. Okay, the biggest benefit is there's plenty of it. Okay. And you don't have a secondary surgical site. At our practice, we typically use, depending on the procedure, either a sterilized cadaver or patient's own bone. And the 2 other types are, xenografts. It's actually cow or pig bone that's used, or synthetic material. So, which we kind of tend to stay away from. So, in our hands, the autogenous grafts and the allografts work very, very well for our patients.
How have you seen your patients respond to this? How has it been life-changing for them getting this procedure done?
It really has. I mean, especially with the implants. We have patients that have been without teeth for 50 years, and they've always been told, you don't have enough bone to place implants. You will be in the dentures the rest of your life. We do these advanced bone grafting procedures that we've talked about, building up the bone, building up the foundation, subsequently placing dental implants, and now they have fixed teeth. That changes their outlook on life, gives them confidence, allows them to enjoy life, enjoy the foods that they weren't able to eat over the past 50 years for some of our patients. So it is a life changer, and it's one of the more gratifying things that we do in our office.
In the last 30 seconds or so, you guys, it's coming up later in October, but you do these seminars monthly where people can come and ask questions.
Yes, that's probably a good place to start. We hold monthly seminars. It's typically the 3rd Wednesday of the month, and I believe our next one is October 18th. And we talk about dental implants, we talk about other procedures that we do. You get to meet the doctors, you get to meet the staff, you get to tour the facility, and from that seminar you're granted a complimentary consultation where you can further discuss your treatment options.
All right, Dr. Aguila, good to see you, sir. Appreciate the time and coming in, and thanks to Jacksonville Dental Specialists, of course, for taking the time. Their number is 904-460-4201 if you want to schedule a consultation. Their website is also jacksonvilledentalspecialists.com.